Hi everybody, Dr. Stephen Davis. One of the things that we do so much of, and we really never really talk about it much, are earlobe repairs. So many women have been wearing heavy earrings for many, many years, or they just may have had a little bit of trauma with one of their children or something like that with someone pulling on the earlobe while they had an earring in. It's one of the simplest things that we can do in an office setting, and it's what we call a torn earlobe repair. And it's fascinating to me how many patients come in when they're coming to get a facelift or something else like that, and they'll say, oh, by the way, can you repair this earlobe that was torn years ago, and they've been trying to like mask it or do other things to make it better. So that's one thing that happens with the earlobe. The second thing is sometimes it's not actually torn all the way through. Sometimes the hole has just gotten so enlarged that every earring that the woman may put in just drops right to the bottom, and it kind of looks odd if the other side doesn't look like that, or if they both look like that, it may look like the earrings are just ready to like fall right out. So both of those things can be done kind of easily. One way is to actually repair the hole itself, and that way you basically have a brand new earlobe, and then we go back and re-pierce it after that area is healed. The second way we could do this, if the hole isn't that enlarged and it just looks a little bit stretched out, we can sometimes inject some hyaluronic acid fillers like Juvederm and Restylane into that area to kind of plump it up so that the earring looks better sitting in that earlobe. Next time you're at your plastic surgeon's office, talk to them about it if that seems to be an issue. Talk to you later. Bye-bye.